This next case is a CT guided of a suspected kidney mass. This patient is positioned supine on the CAT scan table, and as you can see, the surface grid work is in place to localize the areas of interest. Initial slices are taken through the suspected area to localize the area that they're going to introduce the ablation tools. Here we have the suspected kidney under investigation. It's a right kidney. Here's the bottom of the liver, and you have stomach and bowel here, and you can see that there's an area around the kidney that indicates inflammation, and then there's some suspected areas that don't look like part of a normal kidney. This may or may not be the mass. Contrast studies will have highlighted it better, but you can see on the images the grid work that's on the skin that will help localize where the needle for the biopsy is to be placed, and then the cryogenic biopsy needle. So we're going through that. Initial scans indicate that this is indeed the suspected area, and we will continue taking further images to refine the exact optimum area for introduction of the needle. The streaking artifact that you see is introduced because of instrumentation on the patient's left side. Now you're starting to see the introduction of the first set of probes here in the lower part. Here is the needle passing between the ribs on its way to the area of suspected mass. Once they confirm the location of the needle tip, then they will further localize where the probe is going to go. Now here is the needle in profile, but we still don't see the tip. So chances are the tip is between this slice and this slice. So we may see some additional manipulation and reinsertion of the needle. Okay, there's the needle there where the arrow is, and they may introduce another needle to better localize where the suspected mass is best entered. Okay, here we see a second needle coming in using the first needle as a reference, and now we see this black space after the point of the needle. That indicates where the needle tip actually is. Here you see in profile both the first and second needles, and interspaced between the needle tips the area is the area of the suspected lesion or mass. Now from this point on, they may or may not introduce a third needle, which will be the needle that's the cryogenic probe that's used to freeze this area. They could introduce the probe through one of these existing needle shafts and then slide the probe all the way down and place it in position within the tumor. Further images will give you a clue as to what was done. This procedure at this point has probably taken the better part of an hour and a half to do. The needles are advanced in a very slow fashion, and numerous CT images are taken to see where the needles are going. This is necessary so that you don't enter bowel or vessels, which could further complicate the exam. There are several more CT scans to further localize the needle. They arrive at this position, and you can see that the needle tip, or approximate needle tip, is located right at the base of this suspected area or lesion. And it is from this point that the cryogenic probe will be energized, and oftentimes more than once over a period of half hour or 45 minutes. And then further scans will be taken to see what the reaction is of the mass and the tumor, okay, and the kidney itself. Okay, keep in mind this is a functioning kidney, and the probe has gone through at least some partially healthy tissue, so there may be some bleeding and complications. At all times, without CT guidance, this procedure would really not have been possible. These probes are small and thin, and it's unlikely that they would really get a good image under any other modality but presently using CT. So the role of the CT technologist here is critical to demonstrate and assist in viewing the success of the progressive images that will guide the radiologist to proper placement of the probe. The probe has been inserted, of course, and the cryogenic probe inserted. All these are subsequently withdrawn, and the subsequent scans monitored days later will evaluate whether the intervention was successful or not. This area around the kidney may show some further inflammation, and that of course will be watched, as well as the patient's urine and vital signs to see how well they tolerated the procedure.